download our app available from the App Store and Play Store.
Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Let's look at today's daily bulletin. The Union Health Ministry is working to finalize guidelines to do away with the bond policy for doctors based on the National Medical Commission's recommendations in this regard, the official sources have revealed. According to the bond policy, doctors are required to serve for a specific period in state hospitals after the completion of their undergraduate and postgraduate degrees, failing which they have to pay a penalty amount specified beforehand by every state and union territory to the state or the medical college. The safety of aspirin when used to prevent heart attacks, strokes and possibly some cancer may be improved, according to a recent study which indicated that the risk of stomach bleeding caused by long-term aspirin use can be decreased with a brief course of antibiotics. The results of the HEAT, that is the Helicobacter pylori eradication aspirin trial, which was led by Professor Chris Hockey from the University of Nottingham School of Medicine and Nottingham Digestive Diseases Centre and funded by the National Institute for Health and Care Research Health Technology Assessment Programme, are published in The Lancet. In an effort to ensure the quality and efficacy of medications and uniform administration of drug regulation, the Ministry of Health and Family Welfare, the Government of India, has formed a 7-member panel to produce a thorough national drugs database of drug formulations manufactured and marketed in the country. Regarding the aforementioned, India's Drug Controller General V.G. Somani has released an office memorandum dated 27th of October titled Construction of a Committee for the Development of the National Drugs Database, highlighting the importance of a comprehensive database of drug formulations manufactured and marketed in the country. The National Consumer Disputes Redressal Commission, the NCDRC, recently exonerated a Telangana-based hospital and doctor from charges of medical negligence while performing hysterectomy operation on a patient. It was held by the top consumer court that there was no negligence while conducting a fibroid uterus transabdominal hysterectomy after it produced the entire medical record and referred to the expert opinion by the Superintendent of Government Maternity Hospital, Hyderabad. Holding that the doctor performed the duty and did not conduct any negligence, the NCDRC bench dismissed the complaint. It observed that the revision petition, being misconceived and devoid of merit, it dismissed.
Mount Sinai and Memorial Sloan Kettering Cancer Center or MSK researchers have identified therapies that can help patients with the blood cancer multiple myeloma who try an immunotherapy known as CAR-T only to find their cancer coming back afterwards. Scientists from Trinity College Dublin have unearthed the secret that may explain why some people are able to resist viral infections, having screened the immune systems of women exposed to hepatitis C virus through contaminated anti-D transfusions given over 40 years ago in Ireland. Between 1977 to 1979 in Ireland, several thousand women were exposed to the hep C virus through contaminated anti-D, which is a medication made using plasma from donated blood and given to rhesus-negative women who are pregnant with a rhesus-positive fetus. The medication prevents the development of antibodies that could be dangerous in subsequent pregnancies. Some of the anti-D used during the 1977 to 79 period was contaminated with hepatitis C. Patients with non-metastatic soft tissue sarcoma or STS who need pre-operative radiation therapy can safely receive hypofractionated treatment over 3 weeks instead of 5 with comparable tumor control and no increased risk of major complications in wound healing, according to researchers at the University of Texas MD Anderson Cancer Center. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.